In a year marked by protests calling for police reform, New York City is taking a step towards change.
Treating mental health crises as mental health challenges and not public safety ones is the modern and more appropriate approach.
Starting in February, New York City is launching a pilot program that will send teams of mental health experts and EMS on mental health calls instead of police officers in an effort to reduce deadly police encounters. The question is, will it work?
I think it's a great start. For years, we've known that the way we were doing crisis care in New York sometimes was more traumatizing for people and actually has also sometimes ended in death for people or serious harm to people who were trying to get help.
Sadly, there's a long history of 911 mental health calls ending in tragedy. In 1984, Eleanor Bumpers was shot to death inside her apartment by a cop. In 2016, Deborah Danner was shot and killed by an officer in her apartment just a few miles away. And in March, Daniel Prude died after being restrained by police officers in Rochester, New York. Video of the incident was released in September, further fueling protests against police brutality that were already sweeping the nation.
What do you think this pilot program does well?
I think, for one, when you don't have a responder who is armed with a weapon, the chances of someone being killed or injured from a weapon is going to be eliminated. Having trained clinicians who are responding with an EMS team really allows you both to get a clinical assessment of what's going on, to de-escalate the person who's distressed and needing help, and triage them to the proper level of care to help them get to where they need to be, which may be an emergency room, it may be a crisis center, and chances are it's not the criminal justice system.
See, there's a racial component to this problem as well. Black people are about 3 times as likely as white people to be killed by police, according to a Harvard study and a Washington Post database of police shootings. Another study found the risk for Black Americans with a mental illness is even higher.
So there's clearly police brutality and over-policing of people of color, particularly men of color. And there's also over-policing and brutality of police with mental illness. When you put those two things together, the intercept are people with mental illness who are people of color. And their chances of being traumatized, physically hurt, or even killed by police are going to be higher. But the flip side of that is we're asking the police to do something that they're not well trained to do.
Now, this is a rare issue where police and activists agree. There needs to be a major change when it comes to the issue of mental health. New York PBA President Patrick Lynch is skeptical of the city's plan, but recognized the need for reform. In a statement, he said, "Police officers know that we cannot single-handedly solve our city's mental health disaster, but this plan will not do that either. It will undoubtedly put our already overtaxed EMS colleagues in dangerous situations without police support. We need a complete overhaul of the rest of our mental health care system."
It's a job that the police shouldn't have to do. I mean, they never get enough credit for dealing with this for a job that they're not trained to do.
As a former NYPD officer, how do you feel about this program?
Going into people's homes where, technically danger can lurk behind every curtain. I've been to hundreds of these kind of cases where everything seems to be going good. You can talk to the person, they're pretty much, kind of, okay, understand. And then you get them to the ambulance and then all of a sudden, game on at that point.
What are the downsides, the potential downsides of a situation like this?
Well, I think that's exactly it, right? That we don't have a crystal ball, and walking into a situation that's either a crisis or an emergency, it's hard to know how the person's going to respond. There are occasions when we probably will need to have police backup, but it shouldn't be the first response. But there are models throughout the country that have co-responders that seem to be working quite well.
One of those programs is Cahoots in Eugene, Oregon, a community-based crisis assistance program that's been around since 1989. Last year, Cahoots responded to 24,000 calls.
Our job has existed for 31 years and has always been a contract with the local police department. Because of that rapport, because of that privilege, that access, we are able to make things go well every step of the way.
What do you think is the secret to cultivating that trust between Cahoots and some of the law enforcement agencies that you partner with?
It's a constant being humble, not taking on things that are not appropriate for us. A lot of officers will tell you, like, these aren't calls we want to respond to. It's an experiment, and it's taken 31 years and is still always evolving and getting better and having new challenges in our community.
New York City's upcoming experiment is modeled after this very program.
So let's take some of the clinicians that want to do this and let's start sending them on every call. Let's see what they're actually getting involved with.
As I said, these response teams are going to be helpful, but we need to have a full spectrum of crisis programs. And the best way to deal with a crisis is to actually prevent a crisis.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.